Today you will learn hip manual muscle testing. Remember to begin with fair manual muscle testing. You will verify that the patient is able to complete full range of motion against gravity. If the patient is able to do so, you will proceed with applying resistance. If the patient is unable to move the full range of motion against gravity, you will position the patient in a gravity minimized position. If the patient is unable to move the joint and is having difficulty initiating or unable to do a muscle contraction, you will test the patient for trace or zero. We will be performing hip flexion manual muscle testing. For testing fair, good, and normal, the patient will be positioned sitting upright. For stabilization, you will place one of your hands posteriorly behind the patient's trunk to prevent him from leaning back. For applying resistance, you will apply the other hand anteriorly at the distal end of the muscle to be tested. For fair, you will verify that the patient is able to go through full range of motion. Sir, I will need you to flex your hip. You're going to bring your knee towards your chest as far as you can go and back down. And down. Okay, so now that I confirm that you're able to move through gravity, I'm going to be applying resistance. You are going to move your, listen to my instructions. You're going to raise your knee all the way up, bring it halfway down, and I will be holding resistance for 5 seconds. Ready? Begin. Halfway. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5. Relax. If the patient is able to hold against moderate resistance, he will be graded at 4 out of 5, which is good. If the patient is able to hold strong to maximum resistance, you will grade the patient at 5 over 5, which is normal. If the patient is unable to go through full range of motion against gravity, you will position the patient inside lying and you will support the affected knee and stabilize the hip. When the patient performs the motion of hip flexion, you will not assist with the motion, but only support the knee. Sir, what I need you to do is bring your knee towards your chest as I support your knee. Ready? Begin. Come on back. Relax. If the patient is unable to move the joint or is having difficulty or unable to initiate a muscle contraction, you will place the patient supine and cradle the affected leg. You will palpate the psoas major medially to the sartorius. Just find the crease of the hip joint and palpate in the center. Instruct the patient to try to flex the hip. Sir, if you can, I want you to try to bring your knee to your chest. Okay? Relax. If the patient is able to do a palpable contraction that you can feel, you will grade him at a trace, 1 out of 5. If there is no palpable contraction, you will grade the patient at 0 out of 5, which is 0. We will be testing extension manual muscle tests. We will begin with verifying that the patient is able to perform active range of motion against gravity. The patient position will be in prone. You will flex the affected leg to 90. Have the patient raise their knee off the mat towards the ceiling. Sir, can you raise your thigh up towards the ceiling for me and back down? Okay. Sir, now that you have verified that you can move against gravity, I'm going to be applying resistance. Okay, I'll be stabilizing your PSIS, which is the back of your hip, and I will be applying downward pressure at the distal limb of your thigh. Okay, you will be raising your knee again through full range, come halfway down, and you will hold against resistance for 5 seconds. Ready? Begin. Halfway. 1, 1000, 2, 1000, 3, 1004, 1005. Relax. If the patient is able to hold against moderate resistance, you will grade them at a 4 out of 5, which is good. If the patient is able to hold strong to maximum resistance, you will grade the patient 5 out of 5, which is normal. Okay. Since the patient was unable to perform active range of motion against gravity, you can place the patient sideline with the affected limb towards the ceiling. You will cradle the knee and stabilize the hip. Remember that you will only support the knee and will not assist the patient through the motion. Sir, I'm going to be having you bring that knee behind you. It's called hip extension. Ready? Begin. And come back to center. Relax. If the patient is unable to move the joint or unable or having difficulty initiating a muscle contraction in the minimized gravity position, you will place him prone to test for trace or 0. You will palpate either the tibial tuberosity for the hamstrings or center of the buttocks for the gluteus maximus. For testing purposes, I will go with the gluteus maximus. Instruct the patient to raise their leg against gravity. Sir, I'm going to have you tighten your buttocks and attempt to try to raise your leg. Ready? Begin. Relax. If the patient has a palpable contraction with no joint movement, you will grade him trace, which is 1 out of 5. If there is no palpable contraction, you will grade the patient 0 out of 5, which is 0. We will be performing hip abduction manual muscle testing. To test for fair, good, and normal, the patient will be lying on their side with the affected extremity facing the ceiling. You will stabilize the hip just above the greater trochanter. You will be applying pressure or resistance on the lateral aspect of the knee. First, verify that the patient is able to do hip abduction against gravity. Sir, I will be having you tighten your leg and raise this leg up towards the ceiling. Ready? Begin. Okay, go back down. Relax. Okay. Now that you have verified that the patient is able to move against gravity, you can apply resistance. Sir, you will be raising your leg again, bring it halfway down, and you will try to hold it for 5 seconds. Ready? Begin. Halfway. 1, 1000, 2, 1000, 3, 1004, 1005. Relax. If the patient is able to hold moderate resistance, you will grade the patient at 4 out of 5 for good. If the patient is able to hold against strong or maximum resistance, you will grade the patient 5 out of 5, which is normal. If the patient is unable to do active range of motion against gravity, you can place the patient in a minimized gravity position, which is supine. Make sure that you can place the patient on the outer edge of the table so he or she has room to abduct the leg across the table. You will support the patient's heel just to minimize friction. You will not assist with the motion. Instruct your patient to go through the motion. Sir, with the support of the table and I'm holding your heel, I want you to attempt to move your leg towards me. Ready? Begin. Relax. If the patient is unable to do hip abduction in a gravity minimized position, then you will test for trace or zero. You will palpate the gluteus medius. Find your greater trochanter and go proximal on the lateral aspect of the hip. Instruct your patient to attempt the motion. Sir, I want you to try to move your leg towards me. Relax. If the patient is able to perform a palpable muscle contraction but no joint motion, you can grade them at trace, which is 1 out of 0 out of 5, which is trace, which is 1 out of 5. If the patient has no palpable contraction, then you will grade them at a 0 out of 5, which is 0. If you are able to feel a palpable contraction but no joint motion, you can rate the patient trace, which is 1 out of 5. If there is no palpable contraction, then you will grade the patient 0 out of 5, which is 0. Okay. You will be performing hip adduction manual muscle testing for fair, good, and normal. The patient will be positioned sideline. You have 2 variations for the leg position. Have the patient bend and place their foot in front of the leg that is to be tested. If they are unable to do this position, you can do a modified position where you place the foot behind the leg to be tested and just ensure that they are neutral along the trunk and hip. For his purpose, we will go ahead and do the foot in front of the knee. Verify that the patient can move through full range of motion against gravity. Sir, I'm going to be holding your hip here steady. I need you to raise your leg towards the ceiling and slowly back down. Ready? Begin. And back down. Now, sir, that you have shown me that you are able to move against gravity, I'm going to be applying resistance. So I'm going to have you raise your leg, go halfway down, and hold resistance for 5 seconds. Ready? Begin. Halfway. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5. Relax. If the patient is able to hold moderate resistance, you will grade them 4 out of 5, which is good. If the patient is able to hold strong to maximum resistance, you will grade them at 5 out of 5, which is normal. If the patient is unable to move against gravity, then you will reposition the patient into a gravity minimized position. For hip adduction, we will place him in supine. Move the unaffected leg out of the way so that the midline is clear. Support the heel to minimize friction, but do not assist with the motion. Sir, I will need you to move that leg across over towards the other one. Ready? Begin. Relax. If the patient is unable to move the joint in a gravity minimized position or is having difficulty or unable to initiate a contraction, you will test for trace or 0. You will palpate the adductors proximal in the medial thigh. Instruct your patient to attempt to adduct the leg. Sir, can you try to bring your leg inward towards the other leg? Relax. If there is a palpable contraction but no joint motion, you can grade the patient at trace, which is 1 out of 5. If there is no palpable contraction, you will grade the patient at 0 out of 5, which is 0. You will be learning how to perform internal rotation hip manual muscle test. For fair, normal, and good, the patient will be sitting upright in a 90 to 90 degree angle at the hip and knee. First, verify that the patient is able to go through the motion against gravity. So I'm going to have you turn your thigh inward, which is going to bring your foot outward. Can you go ahead and try that for me? Okay, back down. Good, relax. So now that you have shown me that you can go against gravity, I'm going to go ahead and apply some resistance. You're going to go through that motion again, come halfway down, and I will be holding you for 5 seconds with resistance. You will stabilize for internal rotation on the medial aspect of the distal thigh. You will apply your resistance on the lateral aspect of the ankle. Sir, I need you to go through that motion, come halfway down, and we're going to hold for 5 seconds. Ready? Begin. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5. Relax. If the patient is able to hold moderate resistance, then you will grade the patient 4 out of 5, which is good. If the patient is able to hold against maximum or strong resistance, you will grade them at a 5 out of 5, which is normal. If the patient is unable to move the full active range of motion against gravity, then you will place the patient in a gravity minimized position. For internal rotation, the patient is supine, and you will place the lower extremity and hip into external rotation. You will instruct the patient to move from this position and rotate in for internal rotation. Sir, can you try to roll your leg inward? Ready? Begin. Relax. If the patient is unable to perform this motion in a gravity minimized position, you will then test them for trace or 0. Locate the greater trochanter. Then come just above and posteriorly for the gluteus medius. Another landmark is slightly above the greater trochanter and inward for the tensor fascia lata. It is up to you which one you will palpate. I will palpate the tensor fascia lata. Okay. Instruct the patient to attempt to roll their hip inward for testing for trace or 0. Sir, can you go ahead and try to roll that leg in for me? Try. Relax. If there is a palpable contraction but no joint motion, you can grade the patient at a 1 out of 5, which is trace. If there is no palpable contraction, then you will grade the patient 0 out of 5, which is 0. You will now learn how to perform external rotation manual muscle testing. We will start with the position for fair, good, and normal. The patient will be sitting upright and their hip and knee will be in a 90-degree angle. First, verify that the patient is able to go through this motion against gravity. Sir, I'm going to have you be rolling your thigh outward, which is going to bring your foot inward. Ready? Begin. And relax. Okay. Now, sir, that you have shown me that you can go through this motion, I'm going to be applying resistance. I will be stabilizing on the outer aspect of your distal thigh, and I will be applying resistance medially on your ankle. Okay? So you're going to go through that motion, come halfway down, and hold for 5 seconds against resistance. Okay? Begin. Halfway, hold it. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,005. Relax. If the patient is able to hold against moderate resistance, you will grade the patient 4 out of 5, which is good. If the patient is able to hold maximum or strong resistance, you can grade that patient at 5 out of 5, which is normal. If the patient is unable to perform full active range of motion against gravity, you can position the patient into a gravity minimized position. For external rotation, the patient will be supine, and you will place the leg and hip into internal rotation. You will then instruct the patient to externally rotate and attempt this motion. Sir, with the support of the table, I need you to try to roll your leg and hip outward. Ready? Begin. Okay, relax. If the patient is unable to move the joint in a gravity minimized position or is having trouble initiating or difficulty contracting that muscle, then we can test for trace or 0. You will palpate the gluteus maximus. Find your greater trochanter and go proximal and posteriorly and find your landmark. Have the patient to attempt external rotation. Sir, I want you to try to roll your leg out through the hip and leg. Ready? Begin. Relax. If there is a palpable contraction but no joint motion, you can grade the patient at trace, which is 1 out of 5. If there is no palpable contraction, then you will grade the patient at 0 out of 5, which is 0. Documentation. Once you have completed the manual muscle test for that muscle, make sure that you document the correct side and the correct motion. For example, left hip flexion was 4 out of 5. You will annotate the appropriate level of muscle grade test that you rated for each muscle group.